Last time on Solution Footprints, we started our spotlight on the far-reaching interventions of Professor Soludo, CFR, in the Anambra State health sector. Today on Solution Footprints, we'll highlight the special interventions by the Professor Soludo-led government in providing access to quality and affordable healthcare for the Anambra. Well, these interventions have led to lots of commendations from the Anambra from around the world, talking about how this has bettered the lives of the average people in the state, and also earned the governor the nickname Governor of the Poor, or in Igbo, Governor Umuogbenye. I am Ifi Aron Okafo, and I welcome you specially to this edition of Solution Footprints. We'll take a look at the special interventions, including free antenatal and delivery for pregnant women in Anambra State, among other special interventions. Our reporter takes us on this very insightful and thought-provoking journey as we discover what more the Solution government is doing in healthcare delivery in the state.
Under Governor Chukwuma Charles Soludo's watch, Anambra State government had taken a proactive stance to provide free antenatal care and delivery services to all pregnant women in the state. This is inclusive of cesarean section, also known as CS. Expectant mothers can now enjoy the gift of life without the burden of cost. This program commenced on the 1st of September 2023 and was officially launched by Governor Soludo on the 6th of September same year at the General Hospital, Nobi, as part of efforts to cushion the effects of the petroleum subsidy removal as well as reduce poverty. The governor revealed that this initiative is in line with APGA's mantra of "Be your brother's keeper," and promised it would run for as long as he remains in the saddle of leadership in the state.
We are taking this very serious. Petrol subsidy, and we announced all kinds of interventions. So, in the spirit of Onyaga and 1 year, especially for the vulnerable, free antenatal and free delivery. Until December. Yes. It is ongoing.
As a result, more people started leaving private hospitals to access delivery in public health facilities due to the free antenatal care and delivery services introduced by the government, as well as the qualified medical personnel employed by Governor Soludo through the Ministry of Health. Before the commencement of the initiative, an average of 550 deliveries were recorded monthly in the state. Today, the free antenatal and delivery services by the state government has led to a reduced maternal mortality rate, particularly in low-income families who could not afford the service before now. For instance, in September 2023, when the initiative started, 741 deliveries were recorded, representing 34.7% increase. In October, it increased to 988, representing 81.4% increase. November 2023 recorded 1,230, representing 123.6% increase in delivery, while there was 1,656, representing 201% increase in December 2023, totaling 4,596 deliveries as at the end of December 2023. Till date, 25,181 pregnant women have benefited from attending the free antenatal services, with 4,596 free normal deliveries and 235 delivered by cesarean. All these are free, courtesy of Governor Soludo's revolution in the health sector.
The thing was started in September 2023. So we were told that we'll be having free antenatal cares, free delivery, free lab. So everything free. So people started trooping in because initially before, when you go through our record, before September, the new cases, we normally have about 35, 40 new antenatal cases. But since we started this free delivery and free antenatal, the number increased to 90. We even had 100 and so people started trooping in. Even people, there are people that will book now and you find out that they are in labor. They will go and deliver free of charge. And the governor, our governor, used to supply us with drugs. So we give them antenatal drugs, the hematonis, free of charge, anti-malaria drug, free of charge. Their card is free. They are issued antenatal card free of charge. The laboratory investigation done, everything free, because we normally check their hemoglobin, the hepatitis B, syphilis, VBRL, blood group, malaria parasites. So everything free. So since that September, and people started, we are so busy here that people are many. The one that interested me so much, because there are cases that are supposed to deliver in the hospital, but because of maybe lack of money, they will go to TBAs and risk their life. But now the thing is free of charge. You see them coming to the hospital. Like the case we had now in the ward, she had PIH, pregnancy induced hypertension. If you see the leg is so big, the BP is high, BP 170/95. And there is protein in urine. So this is a critical case, but because this thing is free, she is able to come to this hospital and we've been attending to her. And the condition has been improving. She has received antihypertensive drug and the test done free of charge. So we are happy with Governor Soludo. We do CSA free of charge. A woman came last week with transverse lie. You know, transverse lie is a case for CS. She came on Wednesday with a scan. She has done a scan. Maybe she was booked for CS somewhere else before coming to this hospital. When I saw the scan result, I noticed it is something she cannot deliver vaginally. So I now took her to doctor. Immediately she was booked for CS. In the next day, she had her CS because her expected date of delivery was 18th of January. So on Thursday, the CS was done on her. And she has gone home happily.
From available data, 48% of beneficiaries from this initiative are Anambra, 28% are from Ebonyi, 5% are from Imo, 3% from Abia, and 5% from Enugu. Furthermore, 7% are from the south and 4% are from the north. 97.5% of the benefiting mothers are of the reproductive age of 15 to 49 years, while 2.5% are above 50 years. This is without discrimination, as all residents in Anambra are at liberty to access the free antenatal care and delivery services of the state government.
I'm very, very happy. I'm very, very happy. I'm really excited. I cannot explain how happy I am. I'm very happy. Even my husband is happy, sir. I haven't paid for anything here. Even the lab or everything here is free. They haven't collected even 1 naira from me.
May the good Lord bless him, continue to encourage him as he's doing us good. May good never cease to come to him. And I say thank you on behalf of others.
This initiative has further strengthened the state's number 2 position as the state with the lowest infant mortality rate in the country, second only to Lagos State. Also interesting to note is that not a single woman has been lost since the program started. These also bear eloquent testimonies to the professionalism of the medical personnel recruited by the state government through the health ministry.
Like before, we don't normally come here because everywhere is not like that. But since Governor Soludo came, General Hospital totally changed. Everything about it is, you can see the practical action the man is taking. So I came here because I heard that Soludo have take in charge of the hospital. I was going to private before, but now I'm in general. And since I'm here, I've not have any complication or any issue about the pregnancy. They are taking care of us very good. I've not paid it for anything. Both the car, the lab, and the drugs are free. So I'm so happy, because before it was not like this. You pay a lot of money, 5,000, 10,000 to register for antenatal. But for now, everything is free. Both lab, both the card and everything, even drugs and TT that are given to us is free of charge. So I'm so glad. I say may God bless and protect him and his family and all that is working with him. God bless you all.
It is instructive to note that in July 2023, before the commencement of the free antenatal care and delivery services, about 1,500 healthcare workers were trained in partnership with WHO and UNICEF on directed modified life-saving skills to ensure efficiency and further improve the quality of services rendered.
The goal in this, as Mr. Governor specified, is that we are pushing towards zero maternal mortality. That's the death of a woman during delivery or 6 weeks after delivery. So this, you see, we have been able to close the gap, increase the access to people to health. Because as I said, it's not that we ask people to go and free antenatal. What else are we going to do to ensure that when people go there, they receive quality services? This training we are doing now, last month, the governor shared 120 anti-shock garments to all the mission hospitals in Anambra State and the general hospitals. As we are talking now, we're also procuring and trying to distribute to all the 326 primary health care. All of them, the people that don't have to have this anti-shock garment. What does it do? It's a way of when somebody is bleeding, you put it on the patient. It can able to sustain the patient between 24 to 48 hours, pending the person getting to a place where a definitive treatment will be given to the person. So he found that it's one of the wonderful things we thank Mr. Governor that he has done for the state, and we didn't only give them the anti-shock garment. You can see the training organized by professionals. All of them are being trained practical. You can see on the hands-on on the use of it, and it's a badge training. This is almost 3-4 days it is. So we train all of them, and the import of this is this: we are pushing, driving towards having zero maternal mortality. It's possible, but it sounds difficult, but it's possible with the policy and strategy we are using. I want to thank the governor for these initiatives.
The quality of this training made the staff very excited and enthusiastic about the program, as it had successfully equipped them with knowledge on how to tackle potential challenges that may arise in the course of the antenatal and delivery initiative.
I came to learn on how to use the anti-shock garment. I have been hearing about it, but I have not used it in person. But with the knowledge I gained today, I know I will be able to help women, especially those who are having bleeding after delivery, which can endanger their life. This procedure we have learned today can help a lot to prevent maternal mortality.
A closer look again at how this initiative is benefiting mothers and families in Anambra State shows hundreds of women have benefited and enjoyed these free antenatal care and delivery services of the state government.
Soludo mbeziliwe ni negodo la easy. Obu sosa angole angole. Makana before munye gidime ineche ka iyesiba edogo okota agale mo karo me ogu no ogu mambale mana o mele odola yin kenkeba edogo nwanya muo nwa otu a ibe no no ogu muo nwa muo nwa gị nwa ejewelo nwa without any money.
The arrival of a baby is a thing of joy, But it also comes with huge financial demands, especially for middle-income and low-income earners. But that's a thing of the past in Anambra State, as Anambra can now heave a sigh of relief with the introduction of the free antenatal and delivery services for pregnant women in public health institutions in Anambra State. In so doing, Professor Soludo is wiping the tears and putting smiles on the faces of Anambra.
All thanks to the governor's empathic disposition towards the poor Anambra populace. The benefits the people have derived from the health sector, especially in the area of free antenatal care and delivery services, is mind-boggling. To drive home this point, 2 women recently delivered quadruplets and triplets, respectively, at Referral Health Center, Ogbo, and Enuguabo Health Center, Ufuma, both in Orumba North Local Government Area, without complications and free of charge. Mrs. Amuche Anulefo from Agulu in Anocha Local Government Area gave birth to a set of 4 babies at Referral Health Center, Ogbu, while Mrs. Ujonwa Ede from Ehamufu, Enugu State, but resides in Ufuma with her family, gave birth to a set of triplets at the Community Health Center. The governor's wife, Mrs. Noinye Soludo, paid a surprise visit to the women and said that her husband, Governor Soludo, is deeply devoted to the well-being of the poor and needy in the state.
This is a wonderful initiative. As you all know, our dear Mr. Governor is the governor for the people, for everyone, for the poor. You know, he thinks ahead of time. You know, the initiative is quite a wonderful one, a welcoming one. I visited 2 women. One gave birth to 3 and one 4 quadruplets. The one that gave birth to 3 gave birth through normal delivery. The one that gave birth to quadruplet gave birth through CS, and after the children were taken to intensive care unit. We thank God. The doctor that delivered the quadruplet told us that without the free delivery by Mr. Governor, they would have paid up to 6 to 7 million, because after the CS and delivery of the 4 babies, they were taken to Amako, but they went home free of charge. They didn't pay anything. Yes, they were so happy. We went there with foodstuffs, baby things, napkins, pampers, baby food, and some cash to help them. So they were super happy. They were very happy. Honestly, the joy I saw in these women's faces, I was holding back tears because they were crying, tears of joy. They were crying, praying for him, and it's like that everywhere. Women are so happy.
Mrs. Amuche Anolefo and her babies were later referred to the Chukwuemeka Odumegu Ojukwu University Teaching Hospital, Amako, Oka, where they are currently receiving care in the incubator. They will be discharged soon.
But I thank God for today. They are healthy now, and very soon, by special grace of God, they will discharge us. I appreciate them well, because I don't know how to thank them, because I'm surprised. Because for me, for my family, to pay that kind of money for that trouble, I don't know. We don't have the money, but I thank God for today. They helped me a lot, and I appreciate it very well. God will bless my governor and his wife. Thank you very much.
As a governor loved by Anambra, an interesting scenario played out when Governor Soludo paid an unscheduled visit to a hospital and met a newly delivered baby. With the joy of seeing Governor Soludo there and then, the father of the child, who was overwhelmed with the free services rendered by the hospital in tandem with the governor's free delivery services, with excitement and happiness, consequently named his child the new baby Chukwuma Soludo to portray his joy and happiness for the care rendered to his wife and child without making any form of payment, as all services were paid for courtesy of Governor Chukwuma Charles Soludo.
Soludo no bido n'ụtụtụ ụbọchị. Asị na-enye free antenatal wee na-abịa n'ụlọ ọgwụ a. Oje chekwa efọta njọ ya ma o nwere ego a na Ọchịmụmba. Oje che wee lukwe ka ọ mụrụ nwa iwe enunwa. Ka ọ na-amụtu nwa ọwụrụ nwa nwoke. A na-ekwukwe na nyawu Soludo mee nyawu iwe n'ụlọ ọgwụ a na-abịakwa n'ụlọ ọgwụ a. Mgbe chi na-aṅụrị karịa m obi na-aṅụrị ju m obi. Mgbe chi na iwe mma abịa wu Soludo ebe ọ nọ nwa nwoke nọ Soludo. Na mụnwa na onwe m nwunye m dị ime since o ji ebido nta wee na-abịa apụtụnye n'anya na ọ bụrụ nke na-asị m na akọrọ m n'akụkọ na ebe nsogbu benefit ya ka m ji wee na-agọnya usoro ụzọ ọwụ na ọ ya dịrị ya na mma ọ ya chichiruo n'isi chịtakwuo Anambra steeti ọfụma na ebe na-ekperi ekpere ogologo ndụ.
No doubt, more pregnant mothers in Anambra, particularly the indigent many, will continue to smile under Governor Soludo's administration. For never in the history of the state has there been this kind of a revolution in the health sector by any leader for pregnant mothers, especially one that is done with deliberate consciousness and intentional care for the poor masses.
N'anya ga na-atazi afụfụ anyị na-asị ka Chineke nọ n'ebe a ọ dịkwa ewepụrụ ozi ewezi ihe o ji enyere anyị aka ka Chineke tụkwasị mmadụ kwuru mmadụ n'aha Jizọs ekpere ogologo oge na-arụ isi ike ọchịcha nke a ọ ya adịkwa anyị ọzọ
For Anambra, Governor Chukwuma Charles Soludo has become a burden lifter, a compassionate and empathetic leader who came to wipe their tears by bringing smiles and happiness to their faces.
I really appreciate the governor for the support he has given us. Okay. I really appreciate that.
Yes.
I don't have something to say much, but God bless him richly.
Amen.
Wonderful job he's doing.
Amen.
He adds more years to his tenureship.
Amen. Smile, you girl. Come on, smile. Say thank you, Governor. Thank you.
As many commendations and appreciations from Anambra continue to pour in, the governor has also continued to receive huge commendations from across the length and breadth of the state, from church leaders, community leaders, civil society organizations, amongst others.
The governor is doing a very wonderful job in the state. Even a blind man can testify to it. So he's doing a lot of job, both in the work, both in the road infrastructure, both in the hospital, both in education, both in the self-delivery. So he's doing a wonderful work. God will continue to preserve him and bless him for the people of Anambra State.
Perhaps unknown to Governor Soludo, aside his famous name of Charlie Nwangbafo, which the people fondly call him, the people of Anambra State have again added another nickname, Governor Umogbenye, literally translated in English as Governor for the Poor. For Governor Chukwuma Charles Soludo, it is service to Anambra or nothing. And Anambra across all strata appreciate the governor's work rate, selflessness, and personal sacrifices which he has made through his various interventions for a better, livable, and prosperous Anambra State.
Than 2 years of his assumption of office, Professor Chukwuma Charles Soludo has made far-reaching, massive interventions in the healthcare sector in Anambra State. Join the movement for a livable, prosperous, and healthier Anambra. I am Ife Aaron Wokapo, and I'll see you on the next edition of Solution Footprints.
We're the only ones to make her brighter, the only ones to make her better, the only ones to make Anambra shine. With our sweat and blood, every breath